Okay, good afternoon, everybody. Our apologies about the challenges with the Zoom meeting, but I think, fingers crossed, we have it solved for the remainder of the seminar. I have to apologize sincerely to Dr. Chen for taking 15 minutes of your time. But I guess what we'll do is just curtail any questions at the end, but give Dr. Chen the opportunity to present his full presentation. First off, let me welcome you. My name is Chris Whalen. I'm the director of the Global Health Institute. I'm sitting in for Dr. Sakandi, who's your usual host. She is currently involved in an NIH meeting and was not able to make it to the seminar that she has organized in the past. We appreciate your patience and staying with us. It looks like we've got it finally sorted out. So today we're very fortunate to have Dr. Adam Chen, who is an associate professor in the Department of Health Policy and Management here in the College of Public Health. Dr. Chen has research interests and experience in health economics, mental health, genomics, and social determinants of health. That's quite a broad range of expertise. He worked at the CDC for a number of years and there distinguished himself with an Excellence in Social and Behavioral Science Research Award, and has subsequently been president of various societies relating to Asian health. So, Dr. Chen, it's really a pleasure for you for us to have you here today, and we look forward to your talk entitled COVID-19 and Public Health Systems in China and the US. So you should be able to share screen and begin.
Thank you, Dr. Whalen. Thanks for the invitation. I cannot share my screen at this time. I just ask Julia to maybe either set me as co-host or maybe can change the share screen rights.
Yes, I see the issue now.
I'm not sure if Juliet is monitoring this, but it's all right. Maybe we can just chat. Yeah. Again, thanks for the invitation. It's really a pleasure to speak with you all. Let me get to the. See, I'm going to talk a bit about the US and China health system COVID-19. I think you all know about, the pandemic, and also probably I probably won't be able to touch on the things that you don't know yet. Yeah, maybe we can discuss a bit about the health systems and how we can improve that. We'll also talk a bit about the US-China health and medicine collaboration that happened in the past. Okay. So this is a brief outline of my talk, and I hope we can go through some of the most of the sections. So I want to talk a bit about the introduction of the Chinese medicine and how Western medicine has been introduced into China. Well, most of the early days before 18th century in China, this was a traditional Chinese medicine. There was not, I think there were a couple missionary who were in China in Ming Dynasty, and maybe a little bit later on, they have tried to introduce Western medicine, but it was just probably sporadic cases, not really being built into a discipline. Traditional Chinese medicine, if I can make a comparison, it's probably more like a OD, the osteopathic, in the United States. It's not allopathic medicine. It's probably the status of that. But traditional Chinese medicine in China probably enjoys a better status than the DO, the osteopathic medicine in the United States. And traditional Chinese medicine actually stress on prevention. The fabled Dr. Bian Che, he had a story is that he had three brothers, and himself being the most famous, actually only stressed on only able to do treatment, but his two older elder brothers were good at prevention and also screening, but they were not really famous because, well, things have been solved before this became a problem. So that's something that a philosophy that the Chinese traditional Chinese medicine has been put on to prevent instead of treatment. Well, introduction of Western medicine into China happened in 19th century. Peter Parker, not the Spider-Man Peter Parker, but early day Yale University trained missionary and physician. He founded the first Western-style hospital in China, in Canton, now Guangzhou, on November 4th, 1835. And in Ningbo in 1844, Dr. McCarthy established the first, Presbyterian, church mission station in mainland China, and also a hospital. 1914, Xiangya Medical College was established, but also with support from Yale. 1910, it's Western China Union University Medical College. It's with UK, Canadian, and US missionary. And also Peking Union Medical College, which is 1906, with many of the American missionaries, and I think there might be mostly American missionaries, and also UK, British missionaries as well. So even nowadays, Peking, the several hospitals spin off from Peking Union Medical College and Western China Medical College, they actually still the top hospitals in China. Western China Medical Hospital and Peking Union Hospital, and also Xiangya Medical College. They are still the best medical colleges in China. Well, after the establishment of the People's Republic, the role of a private sector in Chinese health care has diminished. And Ministry of Health became responsible for the provision of healthcare services and running of the country's healthcare network, and transfer private hospitals into public ones. By late 1960s, all the private hospitals has been replaced by public ones and government-funded hospitals, and they provide healthcare in China. But there's also something called barefoot doctors, because physicians were scarce, was very few compared to other countries at that time. So the Chinese government, they tried to push for the barefoot doctors. They are not really real doctors. It's sort of like if we can do it's probably more like a nurse or maybe a physician assistant. They sometimes provide very rudimentary care, and also might be able to provide to write prescriptions. So that's barefoot doctors. It's in the history. It's really useful and provides many of the. So let me provide healthcare for the rural population. Meanwhile, there were public health achievements as well. Between 1950 to 1952, over 512 million over Chinese, and about 600 million people were vaccinated against the smallpox. By 1957, more than 2/3 of China's 2,000 counties had a epidemic prevention station. We'll talk more about this later on. And there was a cooperative medical scheme managed by barefoot doctors. I also wanted to mention that there's another American connection. George Haddam was born, I think, in Buffalo City, in New York. He was American. He was a Maronite American. He was the doctor of Chairman Mao Zedong, and with his leadership, China eliminated STD, sexually transmitted disease, by 1964. But with the economic liberalization, it was reintroduced in the 1980s. Since the reform in 1980s, the rural healthcare system started to collapse. And because of the economic liberalization, because of the privatization of agriculture, well, in the rural communities, the social structure has, changed, and so does the rural cooperative healthcare. There were some recent efforts to try to re-establish village doctors, and I think they were still trying to figure out what's the best model. And during this time, there was also a lot of changes. The Ministry of Health was reorganized into a National Health and Family Planning Commission, taking on combining both the former Ministry of Health and the Family Planning Commission, which actually indicates a diminishing role of the family planning in China. And after 2018, the family planning part totally gone. It became National Health Commission. In China, it's used to have 3 different kinds of insurance: the new rural cooperative medical scheme, urban employee basic medicine insurance, and urban residents basic medical insurance. So they cater to different populations, and all ended in 2018. After that, this was called all 3 health insurance scheme was integrated into one kind under the newly formed National Healthcare Security Administration, which is under the National Health Commission. So that's the organization over the Chinese healthcare system. There were many targets of the healthcare reform that was started in 2009. In 2011, there were essential public health services. I want to stress a bit of that. Since this relates to public health, it's about $11. I think actually they probably added in 5 more yuan, 79 for 2021. So that's about $12 per person. There were public health reform and community health workforce, as well as a target of having universal coverage, which is about 95% of coverage now. So that's the introduction of modern medicine into China and the healthcare reform in China. Next, I'm going to talk a bit about the Chinese public health system. Most importantly, the Chinese Center for Disease Control and Prevention, or China CDC. Well, if we combine the establishment of Chinese CDC and American CDC on one graph, in 1946, the US Communicable Disease Center, CDC, was formed based actually on malaria control in war area, which is an army agency in Atlanta. before that, that time, it's one of the major tasks of US CDC was to control the malaria, to fight the mosquitoes. So if you go to CDC in Atlanta, you might still be able to see the giant mosquito. But at that time, in China, there were some efforts to, in terms of water sanitation campaigns, and new life proposed by Chiang Kai-shek, which is no spitting, anti-smoking, hygiene, things like that. And in 1949, the People's Republic was established, and they started to create the epidemic prevention stations, which they followed the Soviet model to have the function of vaccination, eliminating the 4 pests, mosquitoes, flies, rats, and the sparrow. Later actually became, I think it replaced the sparrow with cockroaches. And in 1967, US National Communicable Disease Center was, renamed. The CDC was renamed into the National Communicable Disease Center. And 1970, as we call it, US Center for Disease Control. It's not plural, it's singular. In 1983, China actually established a China Center for Preventive Medicine, then became the Chinese Academy of Preventive Medicine. In 1980s, US CDC changed its name again, became plural. In the past, it was a singular, which means that the US CDC has a multiple number of CDCs, national centers. And in 1992, it's changed to the name it's currently using, the Centers for Disease Control and Prevention, added prevention. But the funny part is that the Congress actually mandated that US CDC, the abbreviation still kept as CDC, not a CDCP, because CDC has a brand name. So that's US CDC. In 2002, China CDC was established. And I do not have a lot of between this, but the China CDC, the establishment of China CDC actually relates, attributes should be attributable to many of the US efforts, especially former director of the US CDC, Jeff Copeland. He and the director of Chinese Academy of Preventive Medicine, Dr. Chunmei Chen, and also Ke-an Wang and Li-Wing Li, they worked together. They reorganized the Chinese epidemic prevention stations and the Chinese Academy of Preventive Medicine into the Chinese CDC system. Yeah, so it takes the name of CDC. So China CDC, its English name is pretty much copying the US CDC. So there's a deep root from the US CDC. Well, shortly after the creation of China CDC, there's a SARS outbreak. That's actually the SARS outbreak is an alert to the Chinese public health system. After that, the Chinese public health system actually received a lot of funding. Dr. Li-Wing Li, the first director of China CDC, resigned, was forced to resign because of a laboratory incident happened in 2003 after because of, associated with SARS. In 2009, there was a healthcare reform, and this is relates to the public health system. There were efforts trying to put some of the health service to the public health system, the CDC, but the Chinese CDC system was too keen on research, on the research part. They were not interested in taking on some of the service part. So yeah, it did not become reality, and the essential health service still became part of the community health centers instead of CDC. In 2019, Healthy China 2030 released. I think there was some probably resemblance to the American ones as well. In 2019, actually, they were not just a COVID-19 outbreak. There was also a plague outbreak in Inner Mongolia, which actually was handled quite. There were some issues as well, but it was handled well. It was not much consequence. Yeah, but the COVID-19 became something that well, we all see the consequence. So this is a picture of Dr. Jeffrey Copeland and the two directors of Chinese Academy of Preventive Medicine. Yeah, Dr. Copeland shared this picture, asking me to remove, to use PS to remove this T stand. I was not able, I was not technologically competent to do that. So if you guys have any idea, I'll be happy to try. So that's the Chinese CDC, the history. Chinese CDC is a government agency, and its mission, well, you probably can expect that it creates a safe and healthy environment, maintain social stability, ensure national security, and promote the health of the people through prevention and control of disease, injury, and disability. It's organized, I'm not sure if you can see this clearly, but there's different units. There are some units that are directly under the CDC. There are some enjoy probably more independent status, yeah, covering a variety of disease areas. So it's a very, to some extent, it's similar to the US CDC as well. So there's a comparison of US CDC. To some extent, the Chinese CDC actually is much smaller than its US counterpart. In budget of 2020, US has a 6.6 billion, right? And plus 4.8 billion for VFC. But Chinese CDC is about 41 million. And FTE, US is about 12,000. The Chinese actually is just about 2,000. And if we talk about the national workforce, it's about 400,000 in 2011, which is I think one of the reports compiled by either, I forgot what exactly it is. This might be one of the either IOM or maybe one of the other nonprofit organizations that compiled a report about the public health workforce. And you probably will think that the Chinese CDC is a giant organization with direct authority over provincial CDC or county CDC or municipal CDC. No, actually it does not. It's Chinese National CDC is a, to some extent, it's a technical agency under the National Health Commission. So it does not have authority over the other lower level CDCs. They have a what are they called? Technical rights to conduct technical assessment or maybe providing technical consultation, just like US CDC to the local health department, but they do not have a direct authority. So this actually has had some implications during the COVID-19 pandemic. Our sovereign population is very different. Authority, well, the Chinese CDC technically is not a government agency. The reason is that the employees of the Chinese CDC actually are not considered as the equivalents of a civil service in the United States. Their employees would have probably a limited benefits compared to the civil service in China. So it's different. There's a lack of authority in terms of so we briefly talked about the Chinese healthcare system. And well, so the COVID-19 outbreak, I'm sure that you all know about COVID-19 after a year and probably with many papers, and some of you have already published about COVID-19. I'm not sure if it's still necessary to cover all this, but well, I put this slides over here. And I think there was some discussions about what went wrong, especially during the early time of the pandemic. Again, I think many of the topic I talked about probably can be in more than one dissertation topics. I don't think I'm going to be able to cover this in detail and cover this in every aspect or get everything right. So I think I probably will be scratching the surface, and even this scratch probably will be to some extent cursory. Right? So what went wrong? Well, first is communication. Of course, we have a lot of concerns about the transparency, especially during the early days of the pandemic. There were some concerns that actually there were, even on the Chinese media, there were discussions about whether the municipal government has concealed or maybe lack of communication between the municipal government and the national government. So that's one thing. And the other thing is that although China does have a what they call the direct reporting system, the national, if they have a case of pneumonia of unknown etiology, PUE case, it should be put into the system. And after maybe 15 seconds, the folks in national CDC will be able to see that outbreak reporting system. Yeah. It's one of the best. It covers probably 90% of the hospitals and healthcare centers in China. But in this case, there were problems. Number one is that, well, the physicians actually realized that this was a problem, but they sent the report to the local CDC, but they did not put into the outbreak reporting system. And even the director of China CDC, Dr. George Gao, learned about the incident, well, what happening in Wuhan through a online network, chat groups. So this is not through the outbreak reporting system. So definitely there was some issue about transparency, about the risk, about communication of the reporting system. So the physicians, they did realize the problem, and they did want to alert to the Centers for Disease Control system in China, but they did not use the outbreak reporting system, but rather reporting to the local CDC instead of national CDC. So this actually cost a number of, probably a week over time. But even after that, there were also lack of action in China as well. Yeah, risk of communication. I had a paper with my co-authors. We did find, once there was a consistent message, once that the national government has, Chinese government has put attention on COVID-19 and started treating this seriously. They do have daily communication or daily report on this, and actually it's online, and it's helped in some extent to reduce the mobility, reduce the interaction between risk groups of at risk of COVID-19. So to some extent, it's reduced the transmission of the virus. The other side is because the national CDC, the Chinese national CDC, is not able to supervise or to have any authority over the local CDC. Well, the local CDC reports to the local health commission because they receive funding. They personnel decision were decided by the local health commission, right? So there is a lack of coordination between national and the local health authorities. One of the few officials that are being demoted in China actually includes a number of officials in the provincial health commission and also in the provincial health commission. And the other is the emergency preparedness plan. Well, we probably can compare that with the US ones. The US has a very detailed one, although I have to say that the performance of the US system is not as we have expected or that we had hoped, but the US does have a very good emergency preparedness plan, but execution and also the time that it was an election year, I think probably complicates the response to the pandemic. Another point that we wanted to say is the health in all policies. Responding to a pandemic requires efforts from every sectors, every government agencies. For example, the National Healthcare Security Administration in China, actually they had a rule issued and regulation that all the hospitals, if they are treating COVID-19 patients, the expense will not count towards the budget, the cap that allocated to the budget. So this is an incentive for them to take COVID-19 patients. Another rule was that all the patients, they do not need to get referral if they have a COVID-19, if they have a COVID-19 and they need to get treatment. So those two interventions or policies actually helped the Chinese COVID-19 patients to seek care immediately. I think that's something probably helped in the early days that they can cut off the transmission. Meanwhile, I think the US, although Vice President Pence announced that the testing of COVID-19 could be part of the essential health service, which is going to be covered by insurers. I think it was in March 2020. It was a bit, I guess, a bit late in the game, and also it was not clear. Actually, I think some of the health insurers were clarified that only test, and even the test at that time, this was not widely available. So I think there was for both the US and China, I think a coordinated multi-sectoral efforts probably will be helpful in terms of containing the pandemic. So what could be changed? We have talked about the lack of coordination between national CDC and local health departments, and the Chinese government realized that as well. Yeah, so actually they were in the new proposal, they were proposing regional public health centers. Yeah, and part of the reason I suspect is that Shanghai Public Health Center, I think either Shanghai Public Health Clinical Center or Shanghai Public Health Center, they actually played a major role in identifying the genome sequence of COVID-19, of SARS-CoV-2. Yeah, so that's part of the reason that I think they have put forward a plan to have, I think, a number of regional public health centers. So that's one of the things that the new proposal that outlined by the Chinese National Congress. So the system at Chinese CDC and local CDC, how closely they are? Well, not so much. Yeah. Well, because the finance and personnel decisions are by the health commissions. The one way that the US CDC is doing that is trying to address this is to through grants, and well, maybe this is something that the Chinese CDC could do as well. In terms of health in all policies, flu shots, reducing healthcare acquired infection rates, those are also things that could be used. Flu shots is tricky. The reason is that in China, the preventive measures, the prevention, actually are not covered by the Healthcare Security Administration. So they cannot, it's a different budget line. So the National Healthcare Security cannot cover flu shots. It's covered by the Essential Public Health Service, which is the $12 per person. So this is going to be an issue for some of the regions. Beijing and a number of other provinces, they have funded their own initiative. I think they're providing elderly free flu shots, but not widely available to the population. Reducing healthcare acquired infection rates, and the CMS, US CMS is doing a lot of good job in terms of reducing HAI rates. But the Chinese society, I think that could be something that they can emulate, they can learn from the US side. So that's very a scratch of the surface, right? And I want to talk a bit about the US-China health and medicine collaboration. Dr. Juan, do we have some time? Can I get maybe 10 minutes or so? Okay.
Yes, please. So we delayed you at the beginning, but we want to hear your full story.
Okay, thank you. Yeah, so well, I think if you have paid attention to the recent talks, well, even not just the recent, I think over the last not 4 years, probably last 2 years, U.S.-China relations were not as it was as before. But the U.S.-China actually has a lot of health and medicine exchange and collaboration. Yeah, as I have mentioned, the creation of the China CDC actually, well, relates to US CDC because of the name, because of many of the program actually has US CDC involvement. And the collaboration, I can give you a little bit, some of the examples. There's a China-US collaboration on NTD prevention, neural tube defective prevention. It was way back. It's probably just after the, well, it's probably a couple of years after President Carter's visit. It was started in early 80s, and it's got funding after 1990s. Yeah, even 1989, the Tiananmen Square event. At that time, the U.S.-China does not have a good relationship. Did not have a good relationship, right? But Congress has still provided money for the project. It was a partnership between the US CDC and the Chinese institutions. And it's really produced landmark findings on the efficacy of folic acid. You know, nowadays we have a mandatory folic acid fortification policy in the US. You know, part of the reason is that there was evidence from this RCT in China. It's a community level RCT. And there was also a US-China global disease detection cooperative agreements between the Chinese National Influenza Center and the US CDC. And they, by 2009, I think the number probably even grew further, there were a network of 411 laboratories and 556 hospitals providing surveillance of influenza. And they provide weekly influenza reports in both Chinese and English, shared among the key stakeholders and published on its website. Yeah. This actually has implication for the US side as well. Well, the US, why we care about this, we wanted to always to be alert about the new strains of flu, right? And this provides a surveillance. Yeah. If it's just in Chinese, it probably takes time for them to understand. If they do not publish this information, well, the US side probably will require additional efforts to do that. So this collaboration, although it does, the collaboration does have an implication for both US, both China and US as well. On Ebola, in West Africa, actually, US and China did collaborate. They provide, US is fantastic in terms of medicine, developing of new medicines, and the Chinese side providing logistics. And I think the MMAP, or the medicine that US developed, they actually did license a Chinese manufacturer to produce that. Outbreak investigation and reporting. The Chinese, there's a new journal called China CDC Weekly, which pretty much followed, modeled after the US CDC MMWR. I was honored and fortunate to serve on the editorial board. This actually is one of the initiative outlined the US-China health partnership under Obama administration. And the Human Genome Project, collaboration between scientific centers in 6 countries: China, France, Germany, UK, Japan, and US. And this, well, in academia and also non-profit foundation and think tanks, so they are making projects as well. The China Tobacco Control Partnership is led by Emory Global Health Institute, working with the think tank, what they call Think Tank Health Development Center in China. Yale University has a long-term, really long-term collaboration with Chinese institutions. The Central South University, they have a lot of influence from Yale, and I actually medical graduates from Central South University. I think they can practice in Connecticut, because of the collaboration between Yale and the Central South University. Harvard China Health Partnership, led by Professor Winnie Ip, is a lot of collaborations as well. Non-profit foundations and think tanks. The China Medical Board, which used to be part of Rockefeller Foundation, they actually created, well, they pretty much funded the Peking Union Medical Hospital and the college. Back at that time, more than 100 years ago, when Rockefeller Foundation was investing in schools of public health in the United States, they also invested in the Peking Union Hospital in Beijing. And it turned out that the money they spent on Peking Union Hospital was more than the money that the foundation, Rockefeller Foundation, spent on the schools of public health in the United States combined. So they decided to spin off the foundation, the operation into what they call China Medical Board to let them self-sustain. So that's why it was called a China Medical Board. Resolved to save lives. This was part of the initiative that of a vital strategy, but led by former US CDC Director, Dr. Tom Frieden. Gates Foundation, well, I know that they're doing a lot of work, but Gates Foundation actually funded the tobacco control initiative in China, but I think more recently they were trying to use the manufacturing capabilities in China to help disadvantaged population in African continent. Yeah. So this actually, this last couple of slides was part of a paper that, a viewpoint paper actually, Dr. Copeland and I and also Dr. Liming Li, Kuan Wang, we are publishing in Lancet. It's going to forthcoming in maybe 2 weeks. So that's I think that's pretty much all. And some of my study I can go over a little bit, and I have a paper on media coverage and mitigating COVID-19 transmission. The media coverage was associated with a reduction of nearly 400,000 cases and 1.4 million of close contacts. Our results also indicate the usefulness of identifying close contacts. There was strong correlation early in the pandemic. And some of the other study which involved, we had a 2020 China COVID-19 survey by Global Health Institute, Xi'an Jiaotong University, which is a 74-item survey administered using via social media in China during April and May of 2020, last year. We had a sample of about 10,000 adults with a wide range of topics. We have several manuscripts under submission, actually. And there was also a smaller survey working with the Beijing Technology and Business University using Dynata.com, which, well, they have a panel in China. They surveyed using online among working populations in several cities in China. We do have a trust of media, government, scientific communities, as well as I think there was doctors and also relatives. We try to assess discrimination because of association with COVID-19 or maybe even the city of Wuhan. And another project that we had was with University of Nebraska Medical Center, Miami University in Ohio. We actually commissioned a survey with National Opinion Research Center, and we had we have finished the data collection last November. We have about 2,700 observations, responses. We have funding from UNMC, Georgia Health Foundation, Chinese Economic Society, and Kevin Lee Memorial Foundation. I think that's might be that's it. And I do have another data set, which is very interesting, and that I haven't been able to work on it. Actually, I'm working on to access it. It's a mobile cell phone data in China. It's one of the 3 major mobile service provider in China. We do the provider actually has about 20% of the market occupation. They have 20% of all the cell phone users. So there were cell phone location data, and they do have some algorithm that can be used to look into how they have been whether they have visited a hospital or not, and how long they have been in a healthcare provider. So we were thinking of using that information to identify if during the pandemic, if there might be changes in mobility, and if there might be changes in the number of visits to different levels of healthcare facility. So that's something that we are thinking of, and that because of 20% of the cell phone user in China is going to be 100 million, at least 100 million of population, and each person is going to generate at least hundreds of records in a day on the location, on the duration, and so it's a large data set. And I think I won't be able to analyze that, there will be someone that we are working on to analyze this type of data. Okay, so that's all from me. So Dr. Weiland, I think that's okay. Thank you again for the invitation.
I think we all ought to give a thumbs up and a clap for Dr. Chen, who's done such a nice job painting some historical details about China and then relating it to the current outbreaks and epidemic that we experience today. Where again, due to our technical delays, I'm going to keep the questions to just a few, if that's okay, Adam. But I see Alex Clay has his hand up, so that's nice. Yeah, please go ahead, Alex.
Okay, thank you. And I can just keep it real quick because there was something you mentioned earlier about doctors in rural China. I recently did a report on doctors in rural India on the system of bonding. It can be a simple yes or no, but has that ever been a system of like pretty much forcing doctors to work in rural China? Just so I can make a connection.
Bonding over. Can you explain a little bit about the bonding?
Yeah, if it's a term, I don't even know if this John Hopkins blog made, but essentially a requirement for doctors, they could pay a fine of what was like around 5 million their currency, 65,000 US dollars to sidestep the responsibility. But if they couldn't pay that fine, they're required to work a service ship in rural India. And I was wondering if there's a requirement for doctors to work in rural China.
No, there was no such a requirement. I think they were having issues to attract medical school graduates to rural area. So that's something that's actually it's a real problem. And rural China actually is experiencing a huge transformation. And sadly, and I guess it probably is not, I shouldn't say sadly, but well, because China is experiencing a really rapid urbanization. So in my hometown, I came from rural area, and the elementary school I went to no longer exists because there was a fewer population. Yeah, so that's actually became a problem. The institutions, the schools, and the hospitals. Because they don't have enough population to support them. Well, the medical school graduates are not really willing to go there, and yeah, so that's actually a issue that the Chinese government needs to address.
Okay, thank you. That's helpful because that's an issue that's going on in India, so I can connect those. Thank you.
Okay, thank you.
Yeah, Adam, just kind of follow up. What percentage of the Chinese population lives in rural area now? I mean, understanding it's changing very quickly, but what percentage now is rural?
I don't have the exact number, but I believe it probably is about 40% or 30 to 40%. In the past, when I was there, when I was in China 20 years ago, I think it's probably 70 or up. Yeah, percent of the population are in rural areas. But yeah. I can actually, yeah, there's a huge transformation. There's a huge rapid urbanization in China.
Yeah, so that's how many millions or billions of people?
Okay. Yeah, that's a 140 million population in China. So if you have a 30%, 40%, it's still going to be maybe 500 million.
Okay. Yes, so just a lot of people.
Right, a lot of people. And there's also a population that what they call migrants. Yeah, migrants, most of the young men or women, and they work in urban area, but during winter, they might go back during the Spring Festival, which is sort of like the Thanksgiving over in the US and the UK. They during the Spring Festival, they will go back to reunite with their family. Yeah. So it's called a migrant population. It's also possibly 100 to 200 million population as well. They are on the road. So actually, the reason that the COVID-19 happened in early January over 2020, and that's actually posed additional difficulties for the Chinese authority to control the pandemic, because early February was the Spring Festival in China. It's supposed to be a huge, mobility, a lot of much higher mobility in terms of population. They will go back from urban centers to rural areas.
Okay. Well, I have lots of questions, Adam, but we'll sit down sometime and talk about them.
Yeah,
as you
definitely.
know, my interest is in TB, and I know that there are some very important historical decisions made about TB and urban and rural and so on. But let me just open it up to the floor for one last question. If I don't see one, then we'll thank you and close for the day. Well, it looks like everyone has had their fill at the moment. So I want to thank everybody for attending and staying with the technical problems we experienced at the start. I also want to thank our speaker, Dr. Chen, who really put a lot of perspective on the Chinese health and the epidemic for us. And he obviously is a very active researcher. And, you know, we look forward to seeing what comes from some of these exciting projects that you have ongoing. So thank you very much, everybody. And thank you, Dr. Chen. And I'll have
Thank you all.
Bye now.
Okay, bye-bye. Okay, thanks. Have a good one.